Well, May is Mental Health Awareness Month, and every year we like to come out and talk to the great people here at Gulfport Behavioral Health on Highway 49 in Gulfport. Dr. Brian Gaddy, who's the medical director and psychiatrist here. Good to see you again.
Good to see you as well.
I always enjoy coming out here. Beautiful day to come out here and talk about the importance of good mental health and dealing with it. Tell us a little bit about what you do here at Gulfport.
Well, what I do is I'm the medical director here, so I primarily lead the medical team and do evaluations for patients who come in the hospital. We really pride ourselves here on a patient-centric approach, so we do an individualized treatment plan for each patient who comes in the hospital, and we try to provide a full spectrum of care from either inpatient treatment or outpatient treatment, or both.
Because each person is going to be different.
That's right.
Each person is going to be a different situation in dealing with, and there's so many different levels of dealing with mental health. And you've got a great staff of people here to work with each individual.
That's true. And so our intake staff work around the clock. We have a great intake staff and we're open 24/7. So if you come up to the facility just north of I-10 on 49, you can come in for a free assessment. At that time, we would basically determine whether or not you require inpatient care for maybe if you have some psychiatric emergency or something like that, or outpatient care for substance use treatment or depression and anxiety. We really want to provide a full spectrum of care and a continuity of care for whatever your needs may be.
Yeah, there's a lot of different people that come in here on a daily basis, and like you said, it could be inpatient, which I guess you have facilities for them to stay.
Yes, we have inpatient care where we treat either emergency psychiatric kind of crisis management. We also do inpatient substance use detox, which is a new part of the facility that we've expanded. Mm-hmm. So we've been able to do a lot of good work with the community having that here now too.
What would you consider an emergency situation?
An example of an emergency situation would be like having acute suicidal thoughts.
That's my first thought there.
Yeah.
Suicidal thoughts.
Yeah, and that's I think something that some people really struggle with these days, especially since just the aftermath of COVID and all the stuff that's going on in the world. But we pride ourselves on providing the best care in the region. So if that's something that people are struggling with, we really try to do our best work to help them with that.
And you have a lot of different programs here too to work with them. And again, whether it's inpatient, whether it's outpatient, it's going to be something decided upon an individual situation.
Exactly right. So every person needs something different. Some people need that higher level of care. Some people need either a partial hospitalization program, which is something we offer, an intensive outpatient program, all of these things, or even substance use treatment in an outpatient setting. All of these things we offer for any patient that may need something like that.
Talk about the process of recovery, or the continuum of care.
So as far as the process of recovery, what we normally do is we would say we try to stabilize somebody acutely, and then we would continue their care all the way through to complete stabilization in the outpatient setting, like in their home.
Right.
So that, we try to provide that full spectrum of care from the acute to full stabilization is what we would call it.
And once you deal, you help them here and they go back home or whatever, it doesn't end there.
No, that's really where it begins, I would say. Mm-hmm. Once they go home, we would have them in the outpatient treatment program where we'd really work with them every day or every other day to work through a lot of the issues that they're having and try to set them up for success so that they can meet their potential.
Dr. Gaddy, always a pleasure to talk to you. Thank you so much. Wonderful work that you're doing here at Gulfport Behavioral Health. And we've got some more people that we want to talk to.
Thank you, Jim.
Well, we're talking now to psychiatric nurse practitioner Erica Newsom. How are you?
I'm well. How are you,
I'm
sir?
very well.
Good.
Very well, thank you. Tell us about your role here at Gulfport Behavioral Health.
Okay. As again stated, I'm the psychiatric nurse practitioner here. I work in the inpatient setting as well as in the outpatient setting. So I round and see patients, do medication management, diagnose and treat, mental health conditions.
Well, talking to Dr. Gaddy, everyone's going to be different. So you have to basically assess what's going on, and
Yes.
and you work with the families as well.
I do. I work with the families, and particularly with the children. I get a lot of my information from the families before I even speak with the children to find out what may be going on in the home setting or in the school setting. So they are my first line of contact.
That's always something that a lot of people don't think of. Talk to the kids, get their input as to
Yes.
what's going on, because they may see things through different eyes
They do.
and have different emotions and feelings towards that.
And I do find that out in a lot of my interviews that I do with the families. I try to do interviews separately first, interview with the patient, or excuse me, with the family members first, and then get their idea of what's going on, then speak with the kids, and then try to meet with them together to get an overall picture of what's going on in the home.
Talk about some of the day treatment options.
Okay, so I work in the outpatient clinic, and we take adolescents age 13 to 17, and then on our adult units, our adult treatment, we take age 18 and older. The patients come in having an intake assessment completed, and then once that assessment has been completed, they come down to our department for an appointment, and they see the program coordinator, in which she explains the program to them, and then they would see me for medication management as well as to do a diagnosis and treatment options. Once that has been completed, then we do psychotherapy, set them up for psychotherapeutic sessions.
And each individual one, as I mentioned before, are going to be different, and dealing with them, and a lot of things, and I don't mean this in a sexist way, but it's definitely going to be different between male and female.
Yes, it is. It's different between men and women. It's different between cultures. Everyone is different. I treat each individual person different.
It's amazing the work that they're doing out here at Gulfport Behavioral Health, and all the different people that are involved. And you enjoy your work here.
I do. I've been here a little over 2 years. I've been in mental health for probably 15 to 20 years, almost 20 years total.
Why mental health?
I actually fell into it a little by accident, but I feel like people who are in mental health don't get the treatment that they need. Sometimes there is a great stigma against people who have mental health and mental illnesses, and as well as, they're afraid to seek care because they're fearful of what others will think about them. And so for me, I try to break down those barriers and walls to mental health, and know that they need treatment no matter if it's for their mental health or their physical health, because to me, your mental health is just as important as your physical health is.
If not more so.
If not more so, because one could, hinder the other from getting better.
Thank you so much, Erica Newsom, who is a psychiatric nurse practitioner here at Gulfport Behavioral Health. If you'd like some more information, the number is on your screen. You can give them a call, go on the website, and find out and get a free evaluation if you come here to the Gulfport Behavioral Health Center. They're located on Highway 49 in Gulfport, about a mile north of I-10, right by the post office.
Yes,
so,
right next
thank
door
you
to the
again.
post office.
Thank you very much.
Thank you. Have a good day.